Welcome back, everybody. I hope you had a chance to just drop your shoulders and get a coffee so you can settle in for this next session. One thing I wanted to mention is there is, of course, prizes rebooted into our gamification aspect of this platform. They will be released at random throughout today. So they're getting sneakier in this process so that we don't have, they're all gone again by the morning. So I want you to tune in, continue to sort of look for all of the codes in the scavenger hunt and just really have some fun with it. We don't do that nearly enough, I think, sometimes business. So I'm so excited to see how that goes. Now, this next talk is a panel, and as promised, to begin our day with a hashtag "How Not to Do Patient Engagement." Inspired from Twitter's sometimes cringe-worthy hashtag "How Not to Do Engagement," Rachel Martins, KCHN Family Engagement Coordinator and parent, will facilitate a discussion about challenges and tensions in engagement with a panel of folks who engage in research, including youth, a parent, a researcher, and a trainee. Through dialogue and reflection, they will talk about trust, communication, and the importance of building partnerships. You are invited to join us, get on Twitter, and help envision a future for partnership and engagement by building back trust with that hashtag building back trust. Our sponsor session of today's session is Simon Fraser University. So a big thank you for bringing this to us today. And of course, our moderator, you're going to meet the panel as well, but our moderator is Rachel Martins, Research Engagement Strategist for CAN Child Center for Childhood Disability Research and Kids Brain Health Network, assisting students through the Family Engagement in Research course. Over to you, Miss Rachel Martins.
Thank you so much, Jody. It's an honor to be introduced by you today, and I'd like to welcome you all to today's session, as well as it's my birthday today, so it's a session/party, and I'm very excited that you all came. Wanted to take a moment to introduce you to the point of what we're discussing here today, which was actually a conversation that's gone on for a couple of years now through Twitter, which was the hashtag "How Not to Do Patient Engagement." This came actually as a really interesting meeting point between families, self-advocates, researchers as well too, in terms of how they all came to have this mutual space upon which to talk about all the things that have been challenging or frustrating through the process in terms of just very human actions that sometimes come about where we're not entirely thinking through the process of what we need to be doing within patient engagement within the research setting. And given the time frame that we are in right now, as kind of thinking ahead as a post-COVID world, we want to talk about what it means to build back trust and to start to consider how we can build a system where we, in itself, build back trust. And so I'm just going to continue on here. And now to introduce the session here as well, I wanted to talk a bit about what brings us to the title of Luke's Legacy Lecture. This was a new concept that was started last year in honor of my son, Luke, who unfortunately passed away in 2020. He was a young man who had quite the personality in life, and that there was one thing that I was gifted with as his mom. It was to let him showcase what he wanted to be and who he wanted to be, even if it was a bit of a prankster, a bit of a narcissist. He basically wanted to honestly have this space upon which he could help everybody to understand how awesome he was. And we want to highlight what it means to give every child that opportunity to just live that full life, feeling confident and just moving through the world like it's just a beautiful thing to watch as they grow and develop. So as I mentioned, this session it started basically through Twitter and has kind of moved into this space where I think we never really kind of came to a collective acknowledgement that this hashtag became more of a mutual space. And so that's what kind of brought us to this conversation today, was that we wanted to offer space to really have this conversation about what it means to kind of have this collective space where we all kind of want to do better. And so I'm just going to take a moment here to introduce our panel. For myself, I will mention, as Jody mentioned, I'm Rachel Martins. I am a parent or a bereaved parent. I also work as a research engagement strategist with the Family Engagement and Research course. I am here to connect with families as well as researchers through Kids Brain Health Network in terms of helping to work through a variety of challenges when it comes to patient-oriented research and family engagement. And next on our list here will be Sue.
Thanks so much, Rachel. Good morning, everyone. My name is Sue Simpson, and I am a proud parent of an amazing 32-year-old son who has multiple complex needs. I am also one of the founding parents of the Waterloo Region Family Network, which is a support network for families who have children of all ages with exceptional needs living in Waterloo Region, as well as the current executive director of that organization. And I'm really, really pleased to be with all of you this morning.
And Maya, why don't you take an opportunity to introduce yourself?
Yeah, of course. I'm Maya Pavich. I'm from Calgary, Alberta. I've been the patient advisor for about 7 years, sitting on local, provincial, and national committees and working groups. And I'm just excited to be here because I think healthcare is about connections and bringing people together to improve healthcare for the better.
And thank you very much. And Michelle?
Hi, nice to meet everybody. My name is Michelle Phoenix. I'm an assistant professor in the School of Rehabilitation Science at McMaster University. I'm a CanChild scientist and an adjunct scientist at Holland Bloorview Kids Rehabilitation Hospital. And my work is broadly around engagement in clinical service and engagement in research.
And Sam?
Hi, everyone. So nice to be here. I am Sam Machinski. I'm a registered nurse and a postdoctoral fellow in the School of Rehabilitation Science at McMaster University and CanChild. My primary work is through the Co-Design with Vulnerable Populations Hub, and I'm supervised by Dr. Michelle Phoenix. My research interest is in patient and family engagement and research, particularly with those who may face additional barriers to engagement. I'm a very proud graduate of the Family Engagement and Research course through KBHN, CanChild, and McMaster, and I'm currently coordinating the fall and winter cohorts. It's a privilege to be here.
And we're so happy to have you all, and thank you for joining me on this crazy idea that we all had together. So what we're going to do is next move into our first slide, which is actually was pulled from an actual tweet by a parent advocate. All of the comments and questions or themes that we have pulled here actually came directly from Twitter. And so this comic was actually one that was shared and really reflects kind of the frustrations that we have with tokenism, where sometimes this can feel like parent or family involvement can be just a box that you check off and that's it. And where we want to make sure that this is a place where it's not only a level playing field, but also where you're charging through this together with a collective goal. So we have some questions to start off with this particular theme, but I also wanted to offer up an opportunity for anyone who is listening in today. I will be monitoring the chat box and the Q&A. So if you have any questions or any comments regarding some of the conversation that goes on today, I will be interjecting as moderator on occasion, but I'm going to let our amazing panel have the floor here for this first question. What do you think the ultimate goal for family engagement is?
I think it's to be at the table.
At the table. That is a perfect point for sure. And do you find that there is a distinct meaning behind what that means for you to be at the table?
Well, I feel like, as a youth per se, I feel like my voice sometimes matters and sometimes it's kind of just brushed off. And to be at the table as an equal member is something that's super important, because I think my point of view and my voice matters just as much as a researcher, such as much as a doctor's. It just comes from a different lens. And I think being at the table, being heard, and being listened to are kind of fundamentals to having a trusting relationship and something that helps move healthcare forward.
That's a really great point for sure. And Sue, what is your thought exactly on what family engagement is?
So I would say, to build on what Maya said as well, it's about being listened to, but also being heard. So people actually hearing what it is that I, as a parent or a family member, are able to contribute. And I think it's just important to consider the whole family, not only the parent, but the whole family. It would be the patient who is involved or client from that perspective, as well as all of the family members, is really important.
That makes a lot of sense for sure. And Michelle or Sam, do you have any particular thoughts on this subject as well from your end?
I'll build on Maya's comment as well around the table, and something that I've been pushing myself in thinking about is whose table is it? And often we invite people into researcher spaces, but what I've been struggling with, I guess, in a positive way of conceptualizing the struggle is can we shift the conceptualization of that table to being in community? Can I, as a researcher, be invited into other people's spaces and other people's tables as opposed to being the one who is inviting community in? Because if we make that shift, if we can think about it in that way, then I think we're more likely to be doing work that is meaningful to the communities that we are trying to partner with.
That's a really brilliant concept that you're always making me think. But what it makes me think about actually was a session that I listened in on last year with the World Health Organization talking about the infodemic and all of the challenges that came ahead, and hearing stories from literally all over the world in terms of tackling misinformation and disinformation. One of the kind of the prevailing themes that came out was what it meant to connect with people over cups of tea, and to really kind of help to build that trust and how integral that is to the conversation. So thank you for that bit of philosophy. I think I'm going to hold that in my heart personally. And Sam, do you have a particular thought on this subject too?
Yeah, I would say that when I started, because I'm still a trainee and still really at the beginning of my career, but also my career in learning about patient-oriented research. And I think when I first started, I was very superficial in my thinking that it would be to improve recruitment retention. It would be to improve the research process and how we're conducting research. But I think as I get a bit more further along and thinking about what it means to be meaningful and authentic in this space, I think there's a reciprocal part to that too, and recognizing that there's a deeper story for families. So they're not there for us just to take information and partner and be there, but it's a relationship, it's a partnership. There's understanding, meaning, and there's a deeper story there, I think. And it's been really meaningful to look at that, not just in terms of what could benefit for the research, but what could benefit for this entire space and this partnership and this collaboration, not just for the researcher but also for the families.
That's a really excellent point, and I think that that's such a humongous theme to consider here as well too, is that someone at the end of the day lives out the work that you're doing, and how that looks. We should really honor that aspect as well too. And Sam, you as well know too, through the family engagement research course, that I have the opportunity to connect with a lot of parents about what that experience is, because this is often the first time for them to have somebody validate their life experiences. And that comes with a set of emotions, and in some cases, a lot of grief. So I've had, you hate to do this over Zoom, but at the same time, when somebody's in tears, just kind of contemplating what it means to have someone say that your experience is valid and it's important and a part of this research. You just want to be able to reach out and hug, but we do what we can in these times as well, for sure. So when it comes to kind of the topic of tokenism and some of these beautiful experiences that you folks are all constructing here today, how do you feel that tokenism becomes a barrier to achieving some of these goals?
Maybe can I start us this time?
Sure.
I'm wondering, I sometimes think that the expectations aren't clear on anybody's part, not on the part of the researchers and what we're expecting of ourselves in partnership or of our partners, and not on the part of partners who may have varying levels of experience with research and what their role could be, and that's different for different projects. So even if you have experience, what you do with one project team might not be the same as what you're doing with another project team. But often, both in clinical care and in research, I think we don't necessarily have explicit conversations from the outset about what these expectations are and being able to negotiate them in a collaborative way with all the people who might be involved. And I think when that happens, there's opportunities for upset and miscommunication because things don't go the way that you were hoping that they would, but they perhaps could have or have been improved if those things had been explicitly discussed from the outset.
Like to jump on like what Michelle said, it's about building like a rapport, but also building like the list of things and conditions, but having it as a living document. They can change, they can adapt, they can pivot, but not having them set in stone. I think that kind of avoids the whole tokenistic part. Because like I can tell my story multiple times and it's like the same thing over and over again, but that doesn't push back, it doesn't move forward to like how we actually improve care. So I think there's, just patient advisors that tell stories, but there's also another set of patient advisors that want to do more than just tell a story. And how do we get to that place?
Well, that makes a lot of sense for sure. And I know Michelle and I were having a conversation in the Ask an Expert panel earlier yesterday. And one of the conversations that came up actually was about how to conduct oneself when people have been burned in the past. And I thought that was it's a heartbreaking conversation, but I can definitely say it's something I've heard a lot in the past, and in terms of what it means to build kind of a change in practice and making sure that you're different by comparison. For that, I think we talked a fair bit about what it means to be held accountable. And like you said, Maya, as well, too, about outlining expectations and just really having a lot of open, informal conversations about the process and things like that. And opening up the space for dialogue. One of the conversations I have with parents a lot as well is, can I ask questions? Is it okay if I speak up if someone is talking too fast through a process or things like that, or using big words? And the main conversation I have with people ends up being, yes, ask questions, speak up a lot. These things have a way of kind of getting into the process and making it a lot more challenging. And a lot of these barriers tend to be very human actions as well. But I will mention as well in the comments, Lisa mentions, feeling like you are being heard is so important. Wearing my parent hat, I have struggled with this while trying to get mental health and psychiatric services in place for my own for my own youth as well. So there's a lot of relating to what the conversation that's being had here today. Sam, did you have any thoughts on this as well?
Yeah, I also wanted to add that I think there is this need to rush through processes. And I know time isn't something that we could fix or slow down, but I think it's being really thoughtful about how we use our time. I think there's this expectation in academia, speaking from a trainee perspective, to rush, rush, rush. We don't, have a lot of time to sort of set up grant applications or fellowship applications. Sometimes even those don't have space. I know on trainee applications, there's not space for collaborators to name them at the outset. So you're already setting up the expectation that, trainees were involved in that process. And I think that these, and I know we're going to talk about these in a little bit, but there are these systemic barriers that can lead to tokenism. And I think that it doesn't allow for that meaningful or that authentic partnership to flourish.
Absolutely. Now, Sue, did you have any thoughts on what it means or where those barriers come about with tokenism?
Absolutely. So I think it's something as a parent I'm very aware of and having, and also something that we share with the parents as part of our network as well. Because as Sam and others have mentioned, it's that authenticity that is so important. And I think sometimes when you're invited to a conversation, but only just invited and not really a part of the conversation and not knowing what your role is, or that you can speak up and that you can ask those questions as others have shared, you do feel that it's somewhat patronizing, and you should, sometimes you're made to feel that, well, you should be happy with the fact that you're here. You doesn't need to be anything more, and it needs to be so much more than that. So I think we very much try to stay away from that and caution people to not just accept tokenism, and that it is being authentically involved in these conversations.
Can I just add a comment to that? Because I feel those like authenticity, like they seem like soft skills, but those are the skills that really matter to patients and families. So those are the those soft skills are the things that makes them care. Like it makes me care that you know that I'm valued. And I think that's often missed. Like, right, like you sign up for a committee, a working group, research, whatnot, and you just sit there versus someone actually going out of their way and saying, hey, Maya, what do you think about this? Hey, Maya, I would love to have you join. Do you have any questions? I think that builds trust. And that built that foundation of I value you, value me. Let's work together and respect one another to build whatever we're building. I think we miss the boat on that a lot. So we rush it versus I think that's the main component when building authentic relationships.
Absolutely. I think that that's so vital in many respects. And something I read a while back, I had mentioned this yesterday, but from a research engagement journal was the idea of a sand pit, which I think is such a wonderful analogy about group goals in the sense that nobody runs through sand in a really coordinated fashion, despite what old shows like Baywatch would tell you. It's something to be said about trudging through collective goals in a tiresome way, but doing it together. And how that really speaks so much to what we were conveying here, that these relationships are uniquely human. We need to kind of take them a lot out of the process factor, which is important, but at the same time, we need to just make sure that we all kind of have that important space together. How have you found meaning or purpose in family engagement? I think for myself, I can definitely say I'm now wearing a third hat as a bereaved parent, but also as somebody working in the field. And trying to, it's wonderful to see people starting out in these relationships, be it researchers or parents, and just understanding what it means to connect and seeing more of a community develop and an intention of community. So for me, that's where my headspace is at now. As a parent, it was about not wanting to see other people having to repeat some aspects of my family story. But I don't know if this resonates with anybody off the top here. Feel free to speak up at any point here as well.
I think for me, I found my why. I think I found my why as a patient advisor. I was like 18. I was like, oh, what's a patient advisor? I'll just sign up, see what happens. But I think after joining the youth group, I was like, wow, I can, my voice matters. I can make a difference. I found my people. And that kind of led me into the provincial role and the national role. And it kind of led me to a direction of like my undergrad in communications and how do we actually communicate with, the underprivileged and those that are not just us as researchers or doctors or whatnot, but how do we connect with people on a human level? And that kind of led me into like the healthcare field that I'm in now as like a designer, potentially medical school down the road. So it found my why and it found me a reason, like this is something that I want to do, and allowed me to see like, my story, it is sad, there's a lot of mistakes, but I hope someone learns from that so it doesn't do it. It's like that story doesn't repeat over and over again. It makes the system kinder. I think that's the reason I became a patient advisor at the Forset. Make care better and kinder for the next person. And also being a troublemaker.
That can definitely be helpful too. And I think you have always joked about being a troublemaker. I feel like I'm trying to be a more constructive troublemaker in some respects.
But I also think like being a troublemaker is both being a dreamer of like what a healthcare system can be, but also doing it versus. So that's what I think a troublemaker is. So I think we're all. I love that. We can all be troublemakers. Like I don't mind speaking up, and I think if I speak up, maybe the next person can speak up, and that altogether can improve healthcare for whatever reason.
I love that. I don't think I've ever asked you that personally, and I really appreciate in this particular platform that I've finally had an opportunity to do so. Now, in our comments section, Hajar was mentioning that we all, in essence, at the end of the day, want to be heard, and that really being engaged and seeing the parents and persons with lived experience is really taken into account, impacting research, practice, and policy. I just love that. Now, getting back to the question at hand, how have you found meaning or purpose? How about you, Sue? Is there any experiences that really been particularly meaningful to you in family engagement?
So I think for me, we a lot of what we do is family engagement, and coming from that lived experience, I certainly never thought I would find myself in this type of role and supporting other families. I'm very passionate about it, and I think sometimes that maybe gets in the way a bit, but I think it also makes things a little bit more real. A couple of weeks ago, I heard a parent said, "Thank you for giving me a voice." And that was really something that really resonated with me. And I thought we often are struggling so much and through so many challenges that we don't often stop and hear those appreciations or experience those appreciations. And I think the fact that it wasn't that I was her voice for her, it was that I had given her, or our organization collectively and the other families that she's connected with have helped to give her a voice to continue to advocate for her child. And so that's really, really important. And we've also been able to engage service providers in conversations in a different way now with families, which I think is really helpful. So it's that very authentic engagement and not saying it has to be this way or it has to be that way. It's coming from that lived experience and parent experiences. What is engagement to you? What does that mean to you? And being authentic and supporting that in whatever it is different families are looking for.
That makes a lot of sense for sure. Now, for the researchers in the room here, I'm going to bug you next. And how have you been impacted by it? Be it an anecdote, be it just an aspect of engagement? Has there been something that really resonated with you in the past?
For me, I think a lot of this has been relationship driven, and I've been so lucky to work with parents and youth and colleagues along the way that it's sort of a joy to do the work. It's more motivating. There's so much passion behind it, and when we produce whatever we produce, it's important that everybody feels proud of that work in the end. And I think that's so validating for me. And my research is really clinically applied. And so I'm curious about questions that will make a difference in the everyday lives of children and families, and how we offer services or work together with families in service delivery. So the questions, they're driven by families, by clinicians themselves. And so it's a long process to do research, but at the end, you never want to be stuck with something that won't be implemented, or that people will look at and say, well, that's not going to work for us because of X. If you can identify those things at the outset or way earlier in the process, then the knowledge translation on the other end and moving things into the world is so much smoother, because that people were already behind these ideas all the way along.
That's an excellent point. And from your perspective, Sam, as someone who's kind of more, I hesitate to say starting out, but you were earlier in your career. Have you had a particular moment that resonated with you?
Yeah, and it sort of jumps off from what Michelle said around, having the questions from the outset and making sure that they're relevant. And I think back to my PhD work, which wasn't very long ago, but I didn't include families on my PhD work. And it was really unfortunate. As we were working through like recruitment and data collection, I heard from families and they had told me their priorities. And I was talking just informally with other people, and I heard different things that I had not seen in the literature. And I think that made me really reflect on the work that I was doing and would it be actually meaningful for families down the road. And I think that I found the family engagement research course, and it was sort of like an aha moment, like, oh my gosh, this is what I could have been doing. This is how I could have been doing research that would have been meaningful. And it's not to say that my work wasn't meaningful, but I think it's quite different. And I think that it really enforced for me the value and the importance of including family voices right from the outset of the research, ensuring that they are the priorities of family members, that the questions that we're asking are going to be meaningful and related to the issues that are in their lives right now, and not something that we're just seeing in the literature. And I think that sort of clash was a really eye-opening experience And so I think with the family engagement research course, I sort of found the people that I want to spend my career working with, and people who have the same sort of values and are really interested in the same sort of way of doing research. And I think because I'm really early in my career, it feels amazing to have a network of people and collaborations that have been able to build through my time with the Family Engagement and Research course and the Parents Partnering and Research Facebook group. And I think yourself, Rachel, I remember doing recruitment for my PhD project, and you had reached out to me and had offered to, work through like the Parents Partnering and Research because I had been in the FER group. And I just remember going to my partner saying like, oh my gosh, parents want to hear about my research. And it was just such a like meaningful moment for me that it felt like this is where I want to be. This is how I want to keep moving forward. So.
Oh, that's wonderful. And I'm so glad that we had that opportunity to connect when we did. I would be remiss if I did not mention this brilliant comment that I think is such a missed aspect of the conversation as well, too. But this is someone from the Family Support Institute talking about, but once we all get home, they seem to forget all that they learned. And unless the parent is the engager, they are left out again. Then the next event conference comes along with, and it has to be relearned how key parent involvement is. Most families are done, spent, tired, non-engaged because they were not engaged unless they were the driver / engager. It's a tiring circle. And I think that there is something to be said. And this is personal opinion for my own sake, but at the same time, I think it's important to mention that we don't have a lot of information about the life cycle of somebody who engages, and how there's a lot to be said about the diverse reasons upon which somebody comes to be a part of teams. But at the same time, we don't talk about what it means to when you go home and after the process. Some people, there is a sense of closure. For some people, it's very much not so. And I think that there are some very important points to remember through that process, that sometimes they've had such a key connection piece to being a part of this project that when they go home, that's like it's a steep drop off, emotionally speaking. So there's a lot of diverse stories that need to be heard in terms of what and how these relationships should kind of work out in the end here as well. Now, in terms of the big asks, are there any tips or advice that you would give somebody in your particular representative field here today? As we have parents, we have youth, we have researchers, we have trainees. What would be your big takeaway or a bit of advice for someone who is discussing the topic of tokenism?
I think it's just listen. I think just, oh, sorry.
Oh, no, go ahead. Yeah, that's fine.
I think it's just listen and kind of hold space for listening. It doesn't have to be, we're going to do this right away. It's about understanding the person before understanding what the project's about, understanding what their interests are. I am Maya, a person with diabetes, not Maya the diabetic, or Maya the patient advisor. I'm all these other things. It's about understanding who that person is before we jump into the actual relationship of the project. So, and also from a youth perspective, just be patient when youth are kind of responding to emails, because it takes a lot of time. So, just be a little bit patient. And I think it's also about reaching out in different ways. It's not just email, but also maybe calling or texting. I feel like youth are kind of wary of email these days. I am, at least. So.
Well, I can definitely relate to that. I know a lot of parents that I've worked with too have issues with anxiety, and I try to honor that aspect as well, because that just adds to the stress when you have some sort of anticipation or feeling of obligation with certain things, but your life is also just unbelievably overwhelming at the moment as well too. So that can be a very difficult space to communicate from as well. Sue, did you have any thoughts or tips that you would offer to people from a parent's perspective?
So I would say some of the tips that I often share, or we share, again, as parents supporting other parents, would be that it's okay to ask for something. It's okay to initiate a meeting, not just wait to be invited to have a meeting, but to go ahead and do that. As Maya said, having patience and being in a good space to be able to be part of that engagement, so that you don't feel that it is just tokenism, and that it's okay to bring someone with you, to have someone else with you there during those conversations and as part of that emotional support, not to speak for you, but to be there to provide that, so that you don't feel alone and you don't feel that it is only tokenism, that you are going to be heard, or perhaps that person can remind you during that conversation of some of the things you wanted to share and that you might have forgotten in that moment because you are very emotional. So I think it's really just taking that time, being patient, and asking for that time.
Thank you. That's wonderful advice as well, too. Now, Michelle, did you have any particular thoughts on this?
Yeah, I think especially for researchers, it's important to recognize that there is sort of built-in power differentials, whether you're a clinician or a researcher or both. Often, especially youth with disabilities and or family members feel I don't know, that they are at risk for losing something in the relationship, whether it's their clinical service or the ability to participate as a member of the research team. They might not feel like they have the open floor or ability to, as it's been said before, ask questions, but even provide the team with feedback when something is not working for them or they'd like something to go in a different way. And so I think a lot comes back to relationships and making sure that people feel safe and, in fact, are safe to be able to voice, especially disagreements, because it's important to be flexible. And so, if you can monitor how things are going along the way, whether it's communication processes or roles and task timelines, I think it's going to serve everybody on the team better to have honest and open conversations about how those things are working and when they need to be adjusted. But that won't be able to happen unless you acknowledge first that there is inherent power differentials and work to overcome those things together.
Thank you. That's really excellent advice. Now, Sam, did you have any parting thoughts on the subject of or tips would be what we're looking for here today?
Yeah, I think as a trainee, I think one of the most important things that have really helped me and supported me through my learning is having a really supportive environment. So, research organizations that are leading patient oriented research and value the experience and the voice of families and being immersed in those types of cultures. And I think that really sort of goes a long way. But I think that there's also a lot of privilege in that. I think that that's not always the case for all trainees or all researchers. And I think it's having and knowing about communities and people like yourself, Rachel, who are willing and open to share your experiences and support families outside of those organizations. And so I think as a trainee, the advice that I would give is looking for those spaces if possible and using creativity if you can't find them.
That's an excellent point. And now we're going to move to our next tweet, which is actually more from the researcher side, but I think that there's a lot to be said from the parent and youth side as well, too, as to what this feels like on the ground. So it says, when a journal publisher emails your manuscript patient partner, co-author, asking for their degrees and institutional affiliation and tells them they're holding up the publication process for not providing that info, there's something to be said about what we have established in a relatively new system when it comes to patient-oriented research, what we've learned so far, what we have yet to develop from a larger system standpoint, and casting big dreams into the future. Now, there's a lot really interesting projects going on as we speak, things like the SPORE engagement platform, which is something that's ongoing in development. Lots and lots. I could go on in terms of what interesting resources have come about. But how do we think about finding our way through a system and advocating as well too, to a larger degree, about making that system easier to walk through collectively together. Now, one aspect that I think about is, for instance, the Canadian Common CV. Every time I have been asked to bring the registration number that I'm supposed to have, it gives me a lot of anxiety because I can never navigate that website well. So when I think about questions that we can ask here, I think the big top one that we can ask everybody here in the group today is how would you define system challenges? So what does that look like for you in the experiences that you've had? Now, I'm going to go with the researchers first off here, I think, because I think that that's kind of the top of the list here. This impacts you guys a lot.
I think if I were to define a system challenge, I would say very broadly, it's a structural barrier that restricts authentic and meaningful engagement. And it can limit partnerships and contribute to those power imbalances, but they also other families and create a space that it's us versus them. And I think that what we're trying to do is create collaboration, but these systemic barriers really pull apart who is a researcher and who is a family member. And I think that that is part of the barrier that we're facing.
That's a really excellent point. And I think that that's why some of the stress from the stakeholder side can be quite significant, because I've been lucky with a lot of partners who give me screenshots, for instance, of website things and walk me through the process. But why isn't that readily available for anybody? I think that that's just, it should not be that difficult to do. And Michelle, did you have any thoughts on this as well, too, in terms of what you define as system challenges?
Yeah, I love Sam's definition, actually, around these structural barriers. Some other examples that we faced recently include co-authorship with parent partners. And Ray, you were part of this conversation. So what affiliation do people use if what they're drawing from and bringing to the paper, the manuscript, is their own lived experience? They are not necessarily hired on with an institution like researchers often are, and that's the affiliation that you would provide. It's a lot more challenging for some of our parent partners. Is it where they receive service that they're looking for? Other similar challenges might be including parents as co-applicants or co-investigators on research grants, and there are rules around funding systems that don't allow you necessarily to pay your co-investigators out of the research grant, which is fine for researchers who already have a salary. But if you are working with partners who aren't otherwise paid for their contributions, we might prefer to pay them, and they might prefer to be paid for their time on a research project. And so we've been pinned into some boxes around not being able to name them as co-investigators, which is their role. And they do everything that all the other co-investigators do. But if we want to be able to pay them, we're not able to recognize them in that way. So I don't want to take the time with all of the challenges that we faced. Suffice to say that there's lots of different structural barriers we face because these systems were created for academics, and they fit for academics. And we're trying to place sort of, what's the saying? Square peg, round hole. Anyway, there's a mismatch when we try to fit people into these systems that weren't built for them.
Oh, that makes a lot of sense for sure. Has there been any experiences that have really been challenging for you as a youth or as a parent, Sue and Maya?
Well, in social innovation, we got taught like what a system is and its parts, relationships, outcomes. And I think in barriers and challenges, there's kind of different levels of systems. There's like the micro, the meso, and the macro. And I think we kind of put professionals in one system and then we put patients in another system. We kind of don't mesh those two together. Like I don't see myself as a Mount Royal student of information design here. I am a patient advisor, I'm an advocate, and that's my role. And I think in order to redefine and reimagine the system, we need to we have to break open the barriers and allow ourselves to imagine ourselves and dream bigger on how we can name who's been part of the working group. I don't know.
And
It's kind
Sue,
of
how
a
about
weird
yourself?
question, though.
It can be, yeah. And I think that that's
Yeah.
the thing too about the uniqueness of accessing some of the larger, like more complicated systems, is that sometimes some projects you don't even really connect with them so much. It's more just walking into a room, sitting at a table, and offering some insights rather than being put on a grant or something to that effect as well. So there are variations definitely within the conversation. And how about Sue, for yourself? Have you had any challenges with when it comes to the system and some of the larger complications with in this area?
Definitely so, both personally and in my role with the network. And I think some of those barriers are just hearing from people saying, well, we've always done it this way. We can't do that because of this, or we can't from this perspective. And I think being able to challenge that and say, well, why not? Why, and offering other alternatives. And I was a part of a presentation by a parent who has exceptional needs herself, where she was sharing with others the challenges she has in supporting her kids with school. And it was so enlightening to be able to share that and for people to see that. And they didn't understand those barriers that were there for her as a parent to be able to then support her children. And it was something where people realized, oh, we can change things. We can do things a little bit differently. And I think I've experienced that as a parent many times with my child and being told, no, we can't do this. And I think it's just important to always ask that, well, why not? And could we try this? And could we try that? And being able to bring some solutions to the table is really helpful, instead of just criticizing the system, bringing those solutions and hopefully working through those together to move forward.
Oh, I completely agree. And I think that there are a lot of people, patients and parents, who have ended up being innovators as well, too, in many respects, in terms of challenging some of these, well, we've always done it this way, isms, I will call them. I think one of my favorites is Sharon Terry, who was a parent of 2 children, I believe, with a specific type of rare eye cancer. And she had asked a researcher once about what would happen if we got 2 institutions to kind of talk to one another and maybe we kind of collaborated on something. And the scientist basically laughed in her face, and they said, well, you can't herd cats. That's just not what we do. And she says, well, in my case, I thought, well, you can't herd cats, but you can move their food. And so she created her own system upon which they could do the clinical research that was necessary to work specifically within this diagnosis. And I think that there are a lot of areas where those stories end up being quite quiet because they, in effect, are patients. And so they don't really move as with the greatest efficiency in terms of learning what we can do to make these changes. And yeah, so they kind of stay within their own thing, which is kind of unfortunate unless you kind of really go seek out their story. And I think that that's something that we need to consider in the long run, is to how to amplify experiences like that and what was learned from them.
But I also think patient advisors also. Sorry, just one question. I think patient advisors bring that. I think patient advisors bring that, but yes and perspective. It's like, okay, you guys don't talk, but let's and do this and watch me do it. So I think patient advisors bring that. They have that lens of solution mindset versus others are like just dug into problems all the time. So I think partnering and kind of working that out really brings out the best of both worlds. Sorry, that was my little plug.
No, I think that that's a perfectly great answer to this as well, too. And actually a great lead into our next question, which is, how have system challenges affected your work or ability to partner? I think one challenge that has come about from some of the conversations that I have from trainees, for instance, sometimes is perhaps sometimes advisors aren't always keen on the idea of partnership. And so sometimes there is a challenge when it comes to that sense of power and the value system being in the status that you are. Not always the case, but it's definitely something that has come up with in some prior conversations in the past with some students. But I'm not sure if there's somebody who has a story within the panel here to start off with. One comment that came out of this is Marion Williams talked about, can projects include a mentor-parent advisor to help engage and inform parents? I can definitely say that that's happened in some cases, but I think one has to have the budget for that. And so that's not always the case. But there is ongoing conversations about what it means to kind of help mentor people through the process. And I find Med Twitter, for instance, has become a place to have these conversations. And it's in some cases, researchers have an opportunity to hear our thoughts as well, too, being a mutual public space. And that in and of itself can be just kind of a important, honest space without having that awkwardness of being face-to-face to some measure. So to have those conversations and have them witnessed by others, hopefully that can help create change to some measure. But I don't hear about that too often. But again, I digress here. Coming back to what our question was about, how have system challenges affected your experience? I guess would be the next question.
I love when I'm just seen as a patient advisor, and also been asked to sit on like multiple committees and working groups when I'm the only patient advisor there. It's like now I have to represent the entire patient advisor pool and not just my story and what I bring, but it's also about, okay, well, I'm hearing from others, but it's exhausting being the only patient advisor. It'd be nice to kind of have more advisors on the table. And also timing. I feel as a young person per se, I feel old, but I'm still young. Time is also really of a factor because I can't really make meetings. When people send out invites for 2 p.m., I'm like, no, I'm in class. And what do? Do I miss class for a meeting, or do I actually like attend the class, or do I multitask, which I've done before? And it doesn't really work out. So finding time for, when does it work, right? Not maybe during the day doesn't work for patient advisors like myself, but kind of being flexible with that really brings out the patient's voice.
That's a really great point. And I think to some degree, like you mentioned, life happens, and sometimes we need to honor the fact that, you may have a surgery coming up, or so-and-so is sick. To have just one person can be a challenge in terms of really having to balance that when you have expectations and deadlines to meet and things like that as well, too. Sue, did you have any experiences in terms of what creates those barriers for you in terms of system challenges?
So I think I'd like to actually share a proactive approach that we took to something like this. So in our community, we were finding that a lot of parents were struggling to have their voices heard by different professionals. And so what we decided to do is every time we host a workshop, it's always a parent panel and bringing those lived experiences and voices to the table. And so we've invited different professionals who may be just in their education phase, going through that particular piece, or already professionals, so we can go and speak to them and explain situations. So for example, one was really great where a parent was able to say to doctors who are studying, individuals who are studying to be physicians, that when you become a doctor, and if I call your office, I really need to come to see you. I really need to bring my child. It's really the last place I want to come because I need to bring all of my children, or it's challenging to bring my child. So really know that I do need to see you. Don't just sort of push that off to the side and things like that. And so also things like how do you make your waiting rooms more welcoming to families and various things like that. So really interesting tips coming from that lived experiences of what those challenges were that different parents brought. And I think what we try to do is bring many different perspectives. So as parents, we may have some similar experiences, but we also have some unique and different experiences. So really wanting to just be proactive to share that out there. And then also sometimes we've had some issues with service providers where they've said, well, we've had really difficult challenges with families. So how is it going to be different working with your organization? And so just opening that door to say, why don't you give us a try? Let us show you how we can do this. What didn't work in the past? How can we help you to have that trust in us so we can have that trust in you, and building that trust together?
I think you bring up a really excellent point to Sue, in that sense that I think to some degree when it comes to these connections that we make, not everybody has the same philosophies sometimes as well. And so to represent yourself in a larger space and say, like, we try to come at it, from a very professional basis or something to that extent. Like there's so many facets to helping heal the notion of we've been burned before, and to kind of create a new perspective. So good on you guys for helping to make that happen, for sure. Michelle and Sam, have there been spaces that you find have been challenging in this area?
Go with yes and take a page out of Sue's book and try to think proactively about how have we tried to mitigate some of these challenges that occur. So we talked about the challenges with the Canadian Common CV. Actually, it was a Shirk CV, but same challenge with one of our partners. And so I think to Maya's point around time, we just have to make time to help our partners through some of these systemic challenges, not say, okay, I sent you the info, it's up to you to do this, but really it might have taken an hour and a half. Did take an hour and a half to screen share and walk through the login process and walk through the drop down menus and come up with the errors and screenshot what is the next step, and then we did exactly what you said and created that brochure for our other community partners to also be able to use by actually like walking through it side by side and experiencing it. And it's been the same with trying to figure out compensation. I can't tell you the number of emails that have gone back and forth with HR and other departments on campus to figure out how they've navigated some of the challenges that we're coming up against and being able to pay our patient partners. It just takes a tremendous amount of time. But I think if you are a researcher who's engaged people and are committed to doing this in a way that's well, then you just have to accept that it is going to take time, and it's not enough reason to not do it. But you have to recognize and allocate time in your day to be able to work against some of these systemic barriers that they just still exist, and they're going to exist until we can advocate at higher levels to remove the barriers. But until then, I think we need to spend the time in helping people to overcome them.
Wonderful that you make there. And Karen Turner mentions in the chat here that I think of our advisors as a team, not everyone has to play at the same time. That one is going to definitely stick with me. I think that that's such a wonderful analogy in terms of what it means to make the time and just to be accessing people with as much of a thorough nature as you possibly can, but also where they're at. And Sam, did you have any thoughts in terms of what it means to like challenges and things like that, and how we move forward, or things that you've had experiences with in the past?
It's such a great question. And I was preparing for this sort of segment of our talk today. I went back to a paper that was written and co-authored by our co-design hub. I wasn't on the publication, but it's by Sandra Moll et al. And Michelle's on that publication. And this quote really stuck out to me around these dominating ideologies and beliefs with research norms, especially as a new trainee. There's these socio-political environments that privilege the idea of individualism over collectivism, self-sufficiency over collaboration, and scientific expertise over other ways of knowing based on lived experience. And that really resonated with me as a trainee, where I'm putting on applications that I want to be an independent researcher. This is the goal of sort of being a PhD student moving into postdoc, that independence is the way that we are supposed to go. But really, it's about collaboration, and it's about thinking about this in different ways, and that our scientific expertise is not the only way of knowing. And so I think that really made me think about collaboration and the importance of it as a trainee, and thinking about how do we overcome these moving forward, and how do we challenge those notions of the idea of individualism over self-sufficiency, and thinking about those are dominant norms in academia, but how do we overcome them? And I don't have the answers, and I think we are not thinking about those broad answers, but I think there are, like as Michelle said, those things that we can do to be able to overcome some of these barriers. And
I think that's an excellent point. And One thing that we wanted to do next here was to offer this question not only to the panel, but to anyone who's watching today. Please feel free to put your answers in the chat, and I will be amplifying a few of them as best I can through the conversation. But how do you envision a more family or researcher-centered system, like both where collaboration is just ready to work in a good way? What would that look like to you? So by all means, please feel free to put it in the chat as well too, because we would love to hear your answers. And there's literally no wrong answer here as well. So how would you envision a more participation-centered system?
That's a really tough question.
I think you actually brought up a really great point earlier on, Maya, in terms of the fact that we talk about this as being an either or, like one-sided thing, but really one of the biggest tangible goals that have come out from this conversation today has been that advocacy needs to come from a number of levels. So you brought your own brilliance to this conversation already. Job well done. Anyway.
Thank you.
But in terms of creating a system, I think for myself, having worn both sides of the hat, well, only the researcher one to some degree in terms of the administrative side, but I would really respect a path that everybody can walk through with confidence and knowledge and to feel empowered through that process. For me, that's number one for sure. You don't want to be hampered by process. You want to be able to walk through this together. How about anybody else? Do you have any thoughts on this as well? Michelle?
For me, I think it would take a bit of a cultural shift in how we do research so that, right, it becomes the norm to be doing research in collaboration with partners. And that way the systems have to move and adjust. The timelines that we're on have to move and adjust to allow all people, researchers included, to take the time that it needs to do to partner in a meaningful way. And right now, the way researchers are sort of held accountable for their work, the timing around calls for grants and when those are released and when they're due, they don't really allow for much time to be authentic and reaching out to the people that it's most appropriate to reach out to. You might go to those you already have existing relationships with. And sometimes that's great. And sometimes they're not the most appropriate people to be calling into that particular question, research question. So if we were all in the same boat, and I mean all in terms of patient partners and researchers and clinicians, if we were all trying to do research in this way, I think the systems would have to adjust to make that more feasible for all involved.
Oh, that makes a lot of sense for sure. Maya?
Just to add to kind of like what you're talking about, Rachel and Michelle, is kind of just being okay to fail. It's okay to fail with partnerships. You know, you learn. If the first time doesn't go well, then you learn from your mistakes, and maybe the second time will be better. You know, I think we're all human. We all want to be kind of respected and valued, and I think we all have to be vulnerable with the fact that it's okay to kind of learn from your mistakes and move on. I think that's where I would like to see, you know, patient research go. So I think altogether we all want the same goal. We all want a healthcare system that's functional, feasible, and works for everyone. We all want research that gets into clinical pathways that makes care better, right? So we're all human.
Well, that makes a lot of sense. Absolutely, I completely agree. Some comments that we have here as well too, from the former BC support unit. We are now assessing patient and family engagement during and following funded research projects. It's more difficult to improve what we are not evaluating. That's an excellent point there for sure. Someone mentions, yes, Maya, there is nothing wrong with acknowledging you do not have the answers, but you will find them. I think that frames it really well. Other comments are having this be a part of curriculum. First connect with partners, then take time to build your relationship. Researchers need more training in this area, and parents need to be more informed and supported in their role as partners in researchers. And evaluation of research projects should include family input on key areas, i.e. communication as well too. So lots of big dreams here in the comments section, that's for sure. Love to see that. Did anybody else have any thoughts in terms of how you envision a patient partner or researcher-centered system? Sam, how about you?
I think it's about embedding patient voices into organizations and starting there. I think that is a bigger system issue, but I think that is something that is tangible. It's a thing that can be done, and it's ensuring that those voices are not just the ones that are easy to access, that we're doing some harder work in reaching other populations and people who might not be as engaged or involved in some of the research. And that's not always easy to do. And so I think that really embedding people into systems and organizations and making people feel comfortable to access those is a key part to this.
That makes absolute sense for sure. Now we're going to move to our next conversation here today, which is the next tweet. And it actually mentions, what matters to me is not being turned into an infographic. Now, this infographic was specifically about cancer patients and about putting people in specific boxes as to things that they value. So what that was frustrating for this person was, what is the purpose of this particular graphic and who was the audience? I'm not sure cancer patients would want, I would just love to know which label they particularly wear. It feels paternalistic. And I can say that I know I would find that frustrating as well too. And have you ever been, as speaking to the panel here today, have you ever been in a group situation where people weren't ready for uncomfortable conversations? And what do you think it takes what do you think is missing to make it productive sometimes in terms of these relationships where things can sometimes get a little bit tense, or you have to have just a moment of honesty or advocacy? Is there something that kind of comes to mind in terms of what has worked and not worked in your particular experience? How about you, Sue? Has there been an experience in that respect?
Definitely a few experiences, quite a few actually, I would say. And I think always trying to come from that perspective of it's okay to take a breath. It's okay to just to be patient and to wait from that perspective, and just really, I'm losing my words here from that perspective. Just not wanting to rush through things and label things, and making sure that people are understanding and open to listening to everyone from that perspective, I think is really, really important. And I've had experiences where that hasn't happened and we've been rushed through. And so a lot of people sometimes have things to share, or parents have things to share afterwards. And I always say it's okay to add that. It's okay if you didn't have that opportunity in that meeting. It's okay to send an email or to have a follow-up phone call and to share, because sometimes in the moment or the emotion, or maybe someone has made you feel uncomfortable and you don't feel that you can share, there's always that opportunity to add. And I think, as Maya said earlier about learning, everything is, I think, about learning. It doesn't matter if we fail, but we can learn from those mistakes, or even those conversations that we have, and maybe not including everyone in those conversations.
Well, that makes a lot of sense for sure. Now, Michelle, have you had an experience where conversations have gotten uncomfortable for whatever reason?
Yeah, I want to go back to Maya's comment about this willingness and openness to failing. And as researchers, and I wonder if other people can identify with this, we're not always comfortable with the thought of failing or not being at the highest level of whatever the thing is. And certainly I peg myself with having some difficulties in recognizing and being open to mistakes, but I think they are necessary. That's a necessary part of doing this work, and being open to feedback of all types, and inviting that from partners. And recently, some of our partners did say that the amount of communication coming from our team was overwhelming, and that we needed to really figure out which things that they needed to be included in and offer input in, and which things didn't, because this is not their full-time job, and they have limited time for the project that they're on. And the amount that was coming at them was just, it was too much. And so in this moment, I'm being reflective, and I felt terribly for feeling like I had done it wrong. But now thinking through that, perhaps it's a good thing that they felt open and safe in bringing that forward. And now we can course correct, because they're with us, I hope, for a very long time on this particular project. And we can have some more dialogue with them around, how do you want to be communicated with? Is it not email? Because that doesn't work very well for everybody. I think the idea that came forward was Slack, or another asynchronous project management software that would work better for them. And to negotiate what are the tasks and roles that you're most keen to contribute to, because you don't need to be on every single email. We do it to be inclusive, but at the same time, it can be overwhelming. So which ones do you want to contribute to? So I think it's a bit of a learn as you go. And if we hold ourselves to a really high standard, then that's okay. But also trying to recognize that things aren't going to go 100% the first time, every time, and that we need to be open to that and learn from those experiences.
Thank you very much, Michelle. And I think we're going to, just for this, move to another conversation here today about how do these awkward conversations come into play when it comes to who's missing at the table? Like, what barriers slow the progress to really kind of creating a kind of a robust representation? I'm thinking predominantly about, for instance, an emphasis with the CIHR for EDI plans, for instance, for equity, diversity, and inclusion, and what that means for the challenges ahead and considerations that need to be made in the future. I think about as well too, about what it means to expand our reach with families within the network here as well too, and the challenges ahead in terms of outreach. I find for myself that to some degree that patient-oriented research is kind of a best kept secret to some degree. A lot of people tend to just kind of stumble across the revelation that they have an opportunity to partner. So how do we really kind of create a space where this is more common conversation, and at the same time build trust? What do you think would be some goals that we can kind of consider when it comes to moving forward? We need to consider about, for instance, having conversations about sort of assets we have with people within our networks and casting goals to the future. But Sue, you had some thoughts on this as well too, in terms of goals for inviting more people to the table.
So, and it's something that we're trying to work through in our community as well. And I think it's just really reaching out and making sure that we're trying to build relationships, trying to make sure that we're not one voice for parents, that we are voices, that there are many voices, and what are the various ways that we can engage people who don't know that there are opportunities out there. I think it's a role of sharing what those opportunities are. And again, how would people like to be included, and how do we do that? And it's an ongoing process. I think for us, it's really important to make sure that disability is included in the EDI conversations, making sure that happens. What is the intersectionality in terms of those conversations as well, and just being very cautious and moving forward and listening to everyone and trying to reflect and taking those opportunities from that perspective.
Thank you very much, Sue. And Maya, do you have any particular thoughts on what it means about bringing more people to the table?
Well, I think traditionally we think of EDI as kind of like, ethnic, race, whatever, but it's also about youth. I think a lot of times we miss the youth voice a lot, maybe, given, timing, whatnot, or maybe they think, youth are not engaged in research. But I think if we engage youth, that kind of helps our research better. But it's also about reaching out to people that we know as in the patient advisor role, but also asking if they have people that they can bring on to the research. I think that's a great way to kind of broaden our networks for patient advisors and
I think that's a
expanding
really
the whole
great idea.
research pool.
For sure. I think about a lot of conversations that have happened in the pandemic in terms of how do we start reaching youth in terms of some of the public health things, for instance. And there can be something to be said about creating an aspect of this in healthcare curriculum or in science classes and things like that about what it means to be involved as a youth. We talk about that from an advocacy standpoint. That's become a growing culture, but we don't really from a healthcare partnership. Maybe that's something that could be considered. Who knows? Mm-hmm. And how about you, Sam? Do you have any thoughts in terms of what kind of goals we could consider moving forward?
Yeah, I think that one of the goals is taking the time to slow down and taking not always the easy path. I think that, as we talked about with structural barriers and tokenism, it's so easy just to rush through the process, put someone's name, but it's really taking the time to slow down, to think about who are we involving, how do we do that meaningfully? Is there other ways that we can approach access and engage with people who have diverse experiences so that the research is relevant to the populations that we're aiming to have the outcomes for. So I think that it's really being thoughtful and meaningful. There's no one size fits all approach.
I think that that's really an excellent point, and I think so much of that comes with just intention. Just this is my value. I intend to implement it in whatever case that may be as well too. Now, Michelle, you have done a lot of work in regards to what I like to lovingly call hardly reached populations and things like that. And I had the pleasure of participating in some of that work as well too. Did you have any thoughts in this particular area that you have learned from?
Yeah, I'll go back to the comment I made earlier around that metaphorical table and where it's situated, because I think if we go out into communities, and there was a great comment in the chat, especially about rural communities who might have difficulty with virtual technology and access. So if we can physically go to the spaces where people already are and help them, help us to get to know who these communities are and what their needs are, and help them to get to know what this research opportunity is all about, and perhaps reassure people that yes, it is actually for you. You can be included in this space, especially for those people who aren't used to being invited in or being included. I think that's maybe a starting point, and then all of the things we've already talked about around building trust. And I do think about diversity in terms of people with disabilities and their ways of accessing the world. And sometimes it isn't through coming into a campus and being part of a large team meeting, right? It might be something smaller, more intimate than that. Maybe at home when where they have their technology and when they're comfortable, where the power differential is balanced a little bit more because we're now in the spaces where people are already comfortable. So I think we need to think outside the box a little bit in terms of both who we're engaging and then where and how we're engaging them.
I think those are excellent points for sure. And moving into the next piece here, I wanted to create a space for some closing thoughts and perhaps some reactions here as well too. This picture of a mural actually comes from a conversation that I had at my first NeuroDevNet conference here in Calgary. And what that experience was all about, all the involvement that I had with CanChild and KBHN came to a head when I had an opportunity to bring a whole lot of parent friends who walked similar paths to their first research conference. During one session, I saw one of the parents actually get up to leave looking quite visibly upset, and they had an opportunity. We had an opportunity to chat in the hall. I thought this was an important time to go see what was wrong. And this mom expressed a fascinating kind of wide world of potential for the first time, kind of honestly being exposed to a research network. She was basically thinking of coupling that whole brand new world that she's suddenly been exposed to with the recognition that the system that she raised her kids in was entirely broken. So in attempting to kind of marry both concepts together, the world felt all the more overwhelming. So I told her a story about intention and of a person staring kind of at a giant blank canvas who worked to a person who worked to study themselves as they set out with the intention to paint this giant mural, that this is my thing and my thing alone that they had to do. They had a small bag of artist tools, but looking back at such a giant blank canvas, they were kind of set into panic in their heart, wondering if they could ever get it done. They felt ill-equipped to the task in front of them, and pressing demand felt huge, and the message was clear that they needed to get this done and that it was only going to be their task and their task alone. It occurs to that person that their tools won't be enough to finish, but they can focus on one piece of that mural. If they took a laser focus on just that small area of scope upon which that they could get things done with the tools and the gifts that they had, that they can invite other people who also have a similar dream and ask them to contribute their time. Everyone has a piece of that mural, and everyone shares new diverse lens on the collective vision, making the mural all the more rich in beauty. The same can be said about the task ahead in partnering in research. We are in a crucial period of time that could have us witness a significant sea change in the way we get things done as we collectively set intentions to build back better. So just like the mural, change comes with big goals, set intentions, and a readiness for teamwork. And so we wanted to invite everybody to have a space to talk about this setting intentions. And I think that's a really important piece to do it under either the conference hashtag, build back better, or building back trust as well too. So either way, to set some sort of goal this week about what your future goals when it comes to partnership and research are. We would love to read about them on Twitter or on Facebook, but by all means, please share them with us today. Now, do you have any thoughts in terms of the panel or my panel friends here today in terms of what it means to kind of contribute to this conversation, to like what's your piece of the mural? What do you feel is your next goal in terms of partnership?
I'll go.
Maya. Mm-hmm.
I think it's just starting now versus we talk about all of these things, but it's actually the action part that's going to be the hardest part. I think it's about starting like small steps that will eventually lead to a bigger goal, but it's also about supporting one another. I think we all can have people that we can lean on for support, advice, and I think we need to build that into the culture as well.
Oh, absolutely. I know for myself. Absolutely. Go for Sam. Starting is great. Absolutely. Yep. Just do it. I like that.
Just do it.
And how about you, Sam?
I think moving forward, it's the intention that it's not just one research project or one funding application, but it's a way of doing research with intention and bringing that into every aspect of my life and not just on my work, and being really meaningful about that.
That's a wonderful thought. And Sue, do you have any parting thoughts in terms of how you were going to contribute to the mural?
Absolutely. So I think, and similar to what Maya was saying, it's that action item. So being very mindful of, it's great to have conversations and we go away and we think about them, but actually putting those words into actions, I think, is really important. And that's what I'm going to try to do with everything in my days to come.
Well, that's marvelous. And Michelle, do you have any thoughts on how you are going to contribute to the mural?
Yeah, I'm going to carry forward this idea of intention. I think that during the time of COVID, especially, a lot of trust has been rightfully lost with people who are engaged in patient engagement spaces. And so when we talk about building back trust, for me, number one is to have everybody come in with the intention of truly wanting to do this in a way that's meaningful and valued by everybody in that space. And I think when you have that intention, then you can have some of those mistakes that are allowable, that we're trying to avoid, but we're never going to avoid them all. And I think you give a little bit more empathy and understanding to the partners on the other side of the table, or maybe we're at a round table in this ideal world where we all recognize that we're doing our best under really hard circumstances and that we're open to learning from and with one another.
Oh, I love this conversation today. This is so marvelous. And I can say definitely for myself, how I like to contribute to the mural is to be able to host conversations like this and to try to ask some of the big questions that are on people's minds in terms of how we collaborate, because we do this better when we are a community. So I wanted to thank the panel here today for participating in this amazing conversation. And I feel like I'm all the more inspired to go out and do big things myself. And I'm just going to hand this back to Jody as well, too.
Well, hello. That was amazing. Thank you for those insights. I think such a conversation when we started this process of patient engagement and really being aware of listening to voices. And you know what I love the most about that conversation is really the bravery and being able to say, listen, sometimes we don't feel heard. Sometimes we really need to, not just pay lip service to having people step in and give an opinion, and then we don't between times. And so I love the insight, I love the engagement and the open conversation. We have some more incredible things coming up today. Again, I really encourage you to step into the poster sessions and step into, the conversations that are being happening with some of the fantastic leaders that are really a part of the discussion today. Kids Brain Health Network has done such a beautiful job of, I think, pulling together such a diverse group of people with this vast array of an experience. So please, put your questions in the chat. I encourage you to chat to each other as we navigate this process today. That was a phenomenal conversation. I think it's time for a little break. We are going to do that now. Rachel, that was just so beautifully moderated. And about 5, maybe even a little bit more, just to navigate back into the next. Listen, this was my favorite part of yesterday because we did this yesterday. The trainee lightning talks. This is our second go at this today. And, again, gathering some of the finest people. When you sit with the winners, the conversation is different. And I will tell you, as a psychologist, I still feel like I just had school, which I didn't. But some of the most important conversations were had when we are putting together innovative minds and thoughts, and what is some of the new areas of discussion that are happening. And so you'll want to miss this. I will tell you, they found some of the finest on the planet here for us. And so what you'll want to do is click on the Trainee Lightning Talks 2 tab after we take this break, and just stay tuned to meet some amazing souls. So let's take a break, get a coffee, stand up, don't check your email, look at you, get a snack, and then come back in, and we'll see you back here shortly.